My name is Clarice Carrillo, and I am the hospice director for Corus. So, excited to be here. I put this little PowerPoint together. I really want to touch base on exactly what Corus stands for, who we are, okay? So our mission, of course, to bring out the courage in others. Now, I love that because when you see Corus on the first page, you'll see it says Corus, but it says here, courage together. So that's what it means, courage together. So bringing everybody together. Love that. And our vision is to be recognized as the market leader in operating provider lead clinically integrated networks, okay? We work with so many partners, and that's what hospice is all about, is working together to ensure that our, over here, that our patients are well taken care of, okay? And our base is, our values, of course, are trust, integrity, teaching, collaboration, transparency, and innovation, and discipline, okay? So here is, hospice is, we specialize care for people who are in the final phases of a terminal illness. Typically, with the life expectancies of 6 months or less, okay? And this is certified by the provider. The focus is comfort and quality of life rather than curative treatment. Our core aspects of hospice care is we focus on the patient, family, and support, provided wherever the patient lives. So it doesn't matter if they're in the home, hospital, wherever the patient is comfortable, that's where education and support to the family members. We provide the emotional, physical, and spiritual aspects of it, and there's also support where patients can go into like a short-term respite, which is a 5-day experience. So if the family or caregiver needs a break, then they get to go to a facility where they'll be taken care of for 5 days. Range of services that are included, we have interdisciplinary team, which is a beautiful thing, which includes there's our chaplain, our bereavement coordinator, social workers, nurses, hospice directors, nurse practitioners, volunteers, CNAs. We are all one big team, and that includes the family and the caregivers of whoever's taking care of that patient. Okay, we cover medical equipment, supplies. We contract with pharmacies who will go out and deliver medications for our patients, okay? And our core philosophy for hospice is patient-centered and family-oriented. So we focus on their care. What are their needs? We need to meet them where they're at. What's their understanding of hospice? What's their understanding of the patient's diagnoses and the progression, right? Focus again, quality of life, right? Hospice neither hastens or postpones death, and that's important for people to really understand. I'm not going to really read it word for word, but that's the gist of the core. We want to support, okay? Again, it's where do we provide hospice? And again, assisted living facilities, skilled nursing facilities, homes, wherever that patient is living is their home. So a lot of people will say, oh, they're just in a SNF. No, they're not just in a SNF. Or they're just here. No, they're not. That is their home. And it's important that we all remember that. Who provides the hospice care? Again, it goes to our disciplinary team of our doctors, nurse practitioners, nurses, our health aides, and our psychosocial team. Okay? It's important, what are services included? What does hospice include in their care? Pain management, symptom management. It can be emotional, right? Physical pain, emotional pain. We want to support whatever that patient is going through. Medications is a big one because some people say, oh, you just come into hospice and we just take medications away from patients. Absolutely not. Good hospices, we meet them where they're at. What do they need? Okay. I found that patients actually have been on what they call beta blockers, right? So it's for blood pressure. So it helps manage the heart rate of it, right? And sometimes they're on 2 of those of the same class. But once we start, titrating or taking one away, well, the patient actually has life in them again. So being able to understand what the patients are taking, and again, it's quality of life is what we really need to focus on.
So what are you taking away?
If they're on the same class of medication that's actually harming the patient and not doing any good for them, we have that discussion with the patient and the family because they're the decision makers, and we explain to them why, we need to take one or the other medication away because it's the same medication, right? That's making them actually sicker than actually helping them. So that's a great question. What I love about hospice as well, we do pre-bereavement, right? What's pre-bereavement? It's while the patient's still alive. They may not understand what's going on. They know they're on hospice and they know they have a terminal illness, but what's actually taking place? What are they feeling? What are they going to go through? Family's the same thing. It's hard to accept. But with pre-bereavement, going through that process along with their social worker, psychosocial team, chaplain, and of course Steve, our bereavement coordinator, it helps support them to go through that process and actually understand what is going on in a sense of emotionally, physically, and how to cope, right? And that's important because that, again, is quality of life. And we got to keep that in mind. That's what hospice is, quality of life, okay? We do have 24/7 support, but that does not mean nurses or CNAs or anybody is in the home 24/7, 24 hours a day, right? But say something happens at 3 o'clock in the morning, family can call, caregivers can call, hey, something is going on with Tim over there and he is in so much pain, or he's having really bad hallucinations, right? You can have good and bad hallucinations, but if they're having those bad hallucinations where they think someone's harming them or people are watching them, that's a problem. We need to get out there. But also even if they're having good hallucinations, meaning at the end of life, a lot of people focus on a corner of a room, or they look like they're looking right at you, but they're looking right through you, and they start reaching. That's okay. So understanding what happens through the process of end of life is where we step in and try to help people understand that and get through it and say, it's okay, and manage what's going on with them at that moment in time. We talk about early referrals for hospice, right? And this is important. And it's because you allow the patient to focus on living, right? Focusing on the best day that they have today, right? They wake up tomorrow, let's help them have another good day. That's what that's about. It promotes to proactive approach. How can we help them? Every day, we just want them to have the best day that they can have. Let's see what else we can touch in. It also allows, and I like this, where it touched on, it allows for different levels of care. Meaning, if they're in their home, they get to stay in the home. Versus being last minute and they're what we call terminal agitation, where they're just uncomfortable, miserable, we get them comfortable and they pass. Right? We don't want that. We want to be able to help them again through this process. Inpatient care if they need it. If we cannot manage symptoms in home, they need a higher acuity care. Okay? Continuous hospice care. There's times where a hospice nurse may have to, be in the home for 6 hours. I actually did that last week. I was pushing meds for 6 hours straight to get this patient comfortable, right? And then there's respite care again. one of the big questions, who's paying for this, right? I can't go on hospice because I don't have money for it, no. Your insurance, Medicaid, Medicare, there's some other insurances, Blue Cross Blue Shield, different types of hospice, insurances that will cover the hospice. And if we don't cover it, then we work with our partners to see what team can actually help and cover. So it's important that we support one another through that. And our volunteer program has been such a blessing to our team and to our patients. Heather has done an amazing job. For those of you who don't know Heather, she's our volunteer coordinator. You know, and it's huge. Being in hospice for 12 years, I've never had a volunteer program like this. And it's the neatest thing ever to hear our patients say, you know, so-and-so brought a dog over, or music therapy, or someone sat with me. We have death doulas, you know, helping them understand life. I had one patient, she says, I'm just living for my volunteers. You know, and she's my feistiest patient ever. I love her to pieces. But yes, so we have therapy dog, patient respite, bereavement support. It goes with that. Reiki, meditation therapy is huge. It's important that people can just actually sit in their own thoughts, but also have support with that. Our hairdressers, thank you. It's big. You make such a difference for our patients. I'll tell you, the same lady that was telling me she lives for her volunteer, she just got a haircut on Monday. She called me first thing and said, I am in heaven right now. My hair is cut. I didn't cut it. So funny. So it's huge. Something as simple as a haircut. Music therapy, companionship, even a handyman. You know. So that it's neat that these people are actually giving up their time to help support our patients. So there's some myths about hospice, right? And we need to clarify that. It's important that we put this out there, education, right? So there's a saying, it's only for the last days of life. Absolutely not. Hospice can be started earlier for better quality of life. That's our focus, right? Choosing hospice means that we're giving up. Absolutely not, right? It's about choosing how to live during your final days, right? Or we speed up death. We expedite things. Absolutely not. That's never the goal, right? Hospice is neither hastens or postpones death. It supports the process. And it's important that we provide that education. And we have some amazing, actually the entire team is absolutely amazing at providing that education to the family and supporting them that way. So the benefits of our interdisciplinary team is we get a little bit of everybody, right? So if somebody needs help with planning their death, well, guess what? The social worker or even the chaplain, they work together to help the family plan through that, but also get through it because that's a hard conversation to have. So tag teaming together is what we bring to the table. Who in our interdisciplinary team can help this patient at that time? So that's what we want to promote and act on, is how we can come together as a team. And it goes back again to our volunteers, the spiritual counselors, even our CNAs. The entire team we come together to help our patients get through these difficult times. It says, what you can expect from hospice, right? And this is big. You know, it's important that families know that we have integrity, that they can trust us, right? We are there for the right reasons, and that is to support our patients and to support the families or caregivers however we can. It's crucial. It's important that we gain that trust with them. Again, it's always patient-centered care. So what we do is meet the patients where they're at. We listen to what their wants and wishes are. It's important. You know, some patients want this extravagant, burial, funeral, mass, celebration of life. And then there's other people who are like, please don't do that to me. Don't let anybody look at me, after I'm gone, right? I just want my immediate family and that's it. It's important that we help the family members who don't agree with them, get them to understand that these are the patient's wishes and wants. Diversity training, teamwork, all of this is what our hospice team can bring to the table.
You sit here. Come on.
And we value integrity, honesty, and ethical behavior. That is so important, and that's what we represent and we bring to the table. And again, supporting patients, families, and caregivers at the end of life, together, it's a must. We must come together as a team, as a whole. Again, going back to what I was touching on, understand and respect the patient, families' beliefs and preferences. Engage with the patient and families in the decisions, in the care decisions. They're driving the bus. It's their wishes. Let them have that, and we respect it, and help them make those wishes come true. Prepare patients and families about what will happen and discuss how they want it to happen. And it's important, this is a big one, validate, educate, and support caregivers while sharing the importance of a self-care. Caregivers also have to do self-care and take care of themselves. But in end of life, it's important, especially as nurses, is explaining to the family the process of dying, what they're going to see. The change of color on people's skin sometimes, right? That scares them so much. Their ears fall back. Sometimes they start swelling or weeping, There's so many things that the body does at end of life. And as a hospice nurse, we walk in and I can sit there and say, okay, I see what's going on. But it's important for me to explain that to y'all, knowing what's happening. Well, the patient may not respond to you, but they can hear you. It's important. Sense of touch. It's important. Well, their hands are so cold. Why could you help them? Explaining them to them, well, the blood is going to the vital organs right now. The brain's saying, I don't need these anymore. Let's go here. So this is why X, Y, and Z is happening. And it's important that family and caregivers all know that that's normal. And it's okay. It's important. And I love this. It says, hospice matters. The end of life deserves as much beauty, care, and respect as the beginning of life, right? In the beginning of life, we're so excited, right? But it goes to the end of life, right? Seeing your loved one pass away peacefully is the ultimate goal. For anybody, nobody wants anybody to suffer, but if you can see your loved one pass away peacefully, then we know as a hospice team, we did our job, not just for them, but for the entire team. So that's so important.
And even for the whole community, actually,
Yes.
right?
Yes.
Because we know from whether it's TV or mass media, this type of thing, we have so many bad, incorrect ideas. You mentioned the myths about hospice, that is so huge. Thank you for bringing them up. It's such a problem we have. But then there's just this fear and issue with dying. So you all have this amazing opportunity in hospice to alleviate, to educate, to bring an understanding so that there's not that fear, not those false expectations. So props to you for that.
Thank you. And it's important, you never want to take people's hopes away, but you never want to give false hope. You listen to them. If that's what they want to talk about and that's what they're at right then and there, you hold their hand. Don't argue with them. Don't say, no, that's not happening. No, that's where they are at that moment in time. So as a team, we come together and we just support them. That's big, and it's important for people to understand that, This is my information here in the back. If you guys ever have any questions, I am more than willing to help and support. I'm excited to go tour your building.
Yeah, I can just show you.
I'm really excited.
Anyone else?
But if y'all have any questions, I am always willing to come out, meet with y'all. If there's a resident, and we're like having troubles and struggling, and the nurse is trying super hard, and they may need a support, you have to call us. Call us. I will be more than willing to go out to support them. It's important. Hospice is my passion, and it's very important to be able to share my gifts, my knowledge to the community and the people. So here is, just in the back, it's just kind of idea what Corus Hospice, you know, what makes us different from other hospices. And I'm very proud of my team. We have a cardiologist on staff. We have a pulmonologist on staff. We have RT, who is a respiratory therapy on staff. Full circle follow-up care after discharge, that's important because these individuals, it's a group of people that support families and help them, you know, say they didn't have a living will or whatever the case may be, they help them through all of that. Let's see what else, there's just so much. If we're going back to quality of life and a patient can actually participate in physical therapy and occupational therapy, and you'll think that would make a difference for them, for their daily living, we offer that. Just because you're on hospice doesn't mean you're gonna lay there in bed. Not on Corus's watch anyway. You know, on our watch we wanna be able to support them in any way, their needs, so.
Thank you for this presentation. It's been such a gift